This shift toward implementation is acknowledged for the first time in 2005, with UN Secretary General Kofi Annan standing before the UN Commission on Human Rights and saying that the era of the declaration is over, that we are now beginning an era of implementation, recognizing the ways in which human rights need to be more than paper documents. They need to be realized in the lives of people throughout the world. Following this encapsulation of an era of implementation, Kofi Annan seeks to mainstream human rights across the United Nations system, recognizing the ways in which every part of the United Nations system needs to implement human rights in its policies, its programs, and its practices. And it's this implementation process that is in many ways so unclear. We know what it means to put treaties into law. We know very little about what it means to translate those international legal obligations into policies, programs, and practices that can realize the highest attainable standard of health for people throughout the world.
You know, governance sounds like a very cumbersome word, but really what it means that national governments have to govern in a way that's efficient and fair. And so governments should follow what Ben and I call principles of good governance. Things like no corruption, transparency, setting clear targets, monitoring those targets, inclusive participation so that you include civil society and other people who are affected, and then ultimately accountability. So these are the hallmarks of good governance, and governments around the world should do that, and we know that many governments don't. They persecute civil society, they violate the freedom of expression and the free press. And they're hardly accountable, and many of them are corrupt. So we need to do a lot at the national level. But also governance is at an international level, because if you think about the United Nations, UNICEF, and of course the World Health Organization, we want them to be governed well, and we want them to be governed by the same principles of good governance that I talked about. And what's really, really important, it focuses on good governance. It has to really make a priority for health and human rights, because those are the two underpinnings of prosperous societies with good well-being. And so good governance at the local level, the national level, and the international level are all critically important for health and human rights.
Despite the expanding scope of scholarship around health and human rights, almost all of this scholarship focuses on national governments, ignoring the wide range of international organizations that seek to implement human rights in their mission and in the way they carry out that mission. And so our volume is the first to systematically examine human rights and global health governance, recognizing the ways in which human rights are crucial, not just in the human rights system, but in the wide range of organizations, with the legitimacy, the competence, and the capacity to implement human rights as a basis to improve global health. In focusing on these issues, we begin in the human rights system, but we think about a much larger set of international organizations. From the World Health Organization's constitutional obligation to realize a human right to health, to the wide range of international organizations with the capacity to address underlying determinants of health, whether the health of the child in UNICEF, occupational safety and health in the International Labor Organization, UNESCO's focus on education and science as a foundation of health. We also recognize the ways in which international economic governance is crucial in realizing human rights for global health, with most of our funding agencies beginning to focus on the ways in which their funding of global health initiatives can either realize human rights or infringe human rights in achieving public health outcomes. And so as we begin to see the wide array of organizations inside the human rights system and outside of the human rights system, we recognize that different institutional factors can support mainstreaming of human rights or inhibit mainstreaming of human rights. Across the organizations, we begin to focus on the ways in which leadership can be crucial within the organization and among member states. We begin to focus on the ways in which civil society can become crucial advocates supporting human rights from the outside. We can think about the inside of the organization and the technical staff either becoming champions of human rights or limiting opportunities to advance human rights in their work. And we can begin to think about the ways in which the human rights system of the UN coordinates with these organizations to advance the work of these organizations and assure that there is collaboration and partnerships that are necessary to advance human rights in global health.
You know, our aspiration and our dream is a world that's dedicated to the human rights of every person on the planet. And that includes their right to health, but it also includes equity and justice. And we all know that we're a long way from that. We have governments that torture people. We have conflict all over the world. We have mass migrations and refugee crises. And so we need to do so much more to defend and protect human rights. So what can we do? Well, my experience is, and it goes all the way back to the AIDS pandemic, is that you need bottom-up social mobilization. You need to have the voices of the people rise up and demand their human rights. That's critically important. I was one of the early pioneers in the AIDS movement, and I admired all of the people around me because AIDS changed the world. There were AIDS advocates that just literally would not let governments like the United States or international institutions like WHO ignore the needs and the rights of persons living with HIV/AIDS. And so we need to use that model of bottom-up civil action where people demand their rights. And you'll be surprised if you have a bottom-up revolution, then it influences governments and it influences the World Health Organization, the UN, and other international institutions. And so what I've been saying all along and what we say in the book is that you have to hold actors to account for defending and respecting and promoting the right to health and all human rights. Because in the end, if you think about any human being, we all yearn for our health and we all yearn for justice and human rights. It's a universal aspiration, and we have to make sure that governments and international institutions respect our demand for the right to health.